For an accurate histological diagnosis, the IR specimen must be fixed flat and orientated. Specimens that are fixed twisted, crumpled, and curled up can lead to an incomplete or less accurate histological assessment. Prior to the procedure, print an A4 size clinical photo with the lesion. Prepare the following materials on a side trolley in the theatre. Assemble the equipment shown. These include a bottle of formalin, 1 tissue cassette, 2 foam biopsy pads, saline, filter paper, forceps, a probe, and a pencil. We use a pencil for labeling because it will not dissolve in the solvents we use in the lab, whereas pen ink will dissolve. The foam biopsy pad is sized exactly to fit into the tissue cassette. The filter paper will be cut to size and the pencil will be used to label the filter paper. The probe will then be used to spread the specimen flat onto the filter paper. Fold the filter paper in half and cut out a rectangle to create a book. Make sure the closed book fits inside the tissue cassette and adjust it if needed. Open up the book and mark the orientation of the specimen on the filter paper book with a pencil. Moisten the filter paper with a drop of saline. Place and orientate the biopsy flat on the marked page of the filter paper book. Gently close the filter paper book to secure the biopsy inside the booklet. Now place 1 foam biopsy pad inside the tissue cassette. Gently place the closed filter paper book on top of the foam biopsy pad. Now complete the sandwich press by placing the second biopsy pad on top of the closed filter paper book. Then close the lid of the cassette. Remember to hear the click. This schematic diagram shows the final assembly of the sandwich press. The specimen is secured within the filter paper book and does not come in contact with the foam biopsy pads. Please be aware of this major pitfall. Do not allow the direct contact between the specimen and the foam biopsy pad, as the rough surface of the foam pads will punch holes in the delicate tissue specimen. Place the completed sandwich press inside the formalin bottle to allow the specimen to become fixed. On the clinical photo, mark the biopsy site and orientation. Send the clinical photo together with the histology request form with the patient details and the specimen inside the bottle. There are 3 key steps in this procedure. First, print a clinical photo before theatre. Secondly, put the specimen in a sandwich press. The final key step is to fix the sandwich in formalin.